Here at Ohio State, we treat patients 5 years and older with allergy shots. SCIT therapy or allergy shots typically is covered by all insurances, including private insurance, Medicare, and Medicaid. The first allergy shot option that we have is called subcutaneous immunotherapy. So with subcutaneous immunotherapy, we're starting out with a very small dose of allergen, and over the course of 3 to 10 months, working up to a full dose of the allergen, you come in to our office for a weekly injection to develop that tolerance and desensitization to the allergen. SCIT therapy covers all the common indoor and outdoor allergens that can cause nasal symptoms, eye symptoms, and breathing symptoms. So it's everything from trees, grasses, weeds, dust mites, dogs, cats, molds, bees, wasps, hornets, and yellow jackets. We have the conventional buildup, and then we have a cluster buildup, which is our faster buildup. So for our conventional buildup, patients come in once per week for about 10 months. And they come in, get their shot, wait, and can go. And then for the cluster buildup option, you only have to come in once per week for about 3 months. For each of the first 5 visits, you're with us for about 2 hours because you're actually getting multiple sets of shots during that 2-hour visit. I kind of think of it as moving up the ladder faster toward that top dose. So after those first 5 visits, then it's a typical length of time. After those 3 months or 10 months, then the schedules look the same between the two, where you pretty quickly move from every 2 weeks to every 3 weeks to monthly for the 3 to 5 years. People commonly see improvement around the time that they're at the top dose when they're getting their monthly shots. So for that faster buildup, that might be 3 to 4 months after starting. For the conventional buildup, that could be 9 months to 12 months after starting. For both of those two options, there's a risk of an allergic reaction, slight amount of itching, swelling at the site of each injection. There's also a risk of what we call a large local reaction, where people can get a lot of swelling at the injection site. That risk tends to be higher with that cluster, the faster buildup option. With also both options, there's a risk of a systemic reaction where patients have symptoms all over their body. That can be everything from hives all over the body to less commonly difficulty breathing to even less commonly low blood pressure. But those are the reasons that we require patients to stay here for a minimum amount of time after each shot. So for both options, we still require patients to take an antihistamine tablet, an allergy tablet on the morning of their allergy shots. For that faster buildup option, we require patients to take another medication called Montelukast or Singulair throughout that first 3 months of the buildup. We encourage patients to continue taking all of their allergy medications during allergy shots. It doesn't negatively affect the effectiveness, and in fact, we actually want patients to take them in order to minimize their symptoms and also keep their asthma under control. To decrease the risk of allergic reactions, we don't want patients to get allergy shots on days that they're sick. We also don't want patients to exercise right before or right after allergy shots because that can increase the risk of an allergic reaction. We also don't want patients to get vaccines within 24 hours before or after allergy shots as well. There's a medication called a beta blocker, which is commonly used for some conditions like high blood pressure, sometimes other conditions like headaches, and it can make allergy shots more dangerous. So if you're on a beta blocker, we'd want you to talk to your doctor or provider about if allergy shots are right for you. If you're on it, it doesn't mean that we can't do allergy shots for sure, but we'd have to take special precautions. We don't want patients to get allergy shots when their asthma is not controlled. So before starting allergy shots, it's very important that we get your asthma under control. And also, if your asthma is flared on the day of your allergy shot, it's really important to let us know so that we don't give you a shot because that could be more dangerous.